In this episode of Beyond the Diagnosis, let me start with a direct question. What if our current healthcare system is perfectly designed to treat disease, but not prevent it? Two patients, same diagnosis, same age, same laboratory values. One receives medication and a 6-month follow-up. The other receives medication plus structured nutrition guidance, sleep assessment, metabolic screening, and close accountability. 5 years later, their outcomes look very different. The difference was timing. Chronic disease continues to dominate healthcare spending. Cardiometabolic conditions remain leading drivers of morbidity and mortality. Yet most systems are still structured around reactive care. Functional and preventive medicine shift the lens. Instead of waiting for disease thresholds, we identify early metabolic dysfunction. We measure trends, we address lifestyle drivers, we redesign follow-up, we work in teams. But prevention is not about abandoning conventional medicine. It is about strengthening it. It requires earlier risk stratification. It requires documentation discipline. It requires ethical boundaries. It requires realistic patient expectations. And it requires humility. Education alone does not change behavior. Structure does. The future of medicine will likely include earlier biomarker tracking, digital monitoring, and value-based models that reward long-term outcomes. The physicians who lead this shift will be the ones who think upstream. So here is my challenge to you. If prevention became your default approach tomorrow, what would change in your practice? Would you screen earlier? Would you follow up sooner? Would you measure what predicts disease instead of what confirms it? If this conversation resonates, leave a comment with one preventive strategy that has worked in your clinic. Share this episode with a colleague who believes healthcare needs to evolve. The future of medicine is not just about treating illness. It is about preserving health. This is Beyond the Diagnosis.